Okay, let's start. This is a recording for the Occupational English Test. The test is held in the PBLA office, Melbourne, 20th February. The candidate name is Mary. The candidate number is 2019-58-1. The interviewer is Sally Smith and the interlocutor number is 1, 2, 3, 4, 5, 6. The roleplay numbers are 1 and 2. The profession is nursing. Good afternoon, my name is Sally Smith. Can you state your full name, please?
My name is Mary George Varghese, and my number is 200019581.
Great. You're taking a test for nursing, is that correct?
That's right.
Great. Thank you. Can I see your ID document, please? Okay, so please confirm your details are correct on the test paper, and then read and sign the candidate declaration on the front of your booklet. Thank you. I'm going to be working with you for this test. There'll be warm-up questions followed by 2 role plays. Remember that this is a test of your English, not your professional knowledge. Please speak naturally. Do you have any questions about this?
No thanks.
The warm-up questions are not assessed. It's a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. So, I'd like you to tell me about your professional background. So why did you decide to become a nurse?
I just like to help, so I like helping people, so I feel like it's good for me to be a nurse, so I can help people and take care of their health.
And what kind of a person makes that good nurse?
I think that is 2 main things: active listening and caring. Yeah. To be a good nurse you have to have these kinds of things.
And tell me about a usual day in your job.
I didn't work yet, but in my placement, when I see people laughing and then they become healthier and more relaxed in the hospital environment, I feel like this is a good day for me.
And what's the best thing about your work?
When you see people becoming healthier and more relaxed and more happier, and they're getting better by time. So, I think this is the best thing.
Thank you. Let's move on to the role plays now. So, I'll take the part of the patient, or perhaps a relative. You take the professional role. So, each role play will last 5 minutes, and the purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No thanks.
Excellent. So, you have up to 3 minutes to prepare the first role play. You will start the role play after that time. You will know when 3 minutes are up. You can ask me if there's anything you're not sure about and make notes on the role play card if you want. There's a pencil for making notes. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the first roleplay and the roleplay number 1 for profession of nursing. Please start preparing now.
Thank you.
The roleplay will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay now?
Yeah. Hi. My name is Mary. I am one of the nurses from the hospital. I came today because the doctor needs you to start insulin. So, what do you feel about that?
Well, to be honest, I am a little bit nervous about the idea of starting insulin injections.
I can understand. It's really new for you to inject yourself with insulin, but I'd like to reassure you that it's easy and it's straightforward. So, I will explain to you how to take that injection and you will be fine.
So, is there any other way? Is there another thing we could possibly do?
About the diet and anything oral tablet, I think it's not the good option for you at the moment, because your diet is not controlling your sugar level in your blood. So, that insulin injection is the best option for you at the moment. It will control your blood sugar level and bring your blood sugar level at the normal level for you. So, I want to reassure you that it's very easy to take insert injection, and I can explain to you how to take it. So, can you get me to tell you?
Yes.
So in the beginning you will take them insulin injection, you open it and check the correct dose and the date on the needle, and if it's right and if it's the right dose the doctor tell you, and then you check on the tummy. So, choose any spot you like and then try to squeeze your tummy like this. And then put your needle. But I would like to explain that you need to change the spot so you don't use the same spot for every time. So, you need to change the spot 1 time here, 1 time there. So, you don't have the bruising and this kind of painful area. Yes. So, what do you think about that?
I mean, I guess as you say I have to because my diet isn't working to control my insulin. I know, I still feel a bit nervous about it. but I guess I could give it a go.
Yeah, and the insulin injection will control the situation for you, and you will get healthy and better. And the insulin will help you get better and improve your condition, make you feel healthier and good again. Yeah.
Is it something I have to do for the rest of my life? I mean, that's I guess also something that I'm kind of nervous about.
Yes. You will take this injection and you will. The doctor will keep an eye on the blood sugar levels, so you will have to do a test for every couple of months or something like that. So, the doctor will tell you exactly. And then you will check your blood sugar. If one stage your blood sugar will become normal again, so maybe the doctor will explain to you another option. But at this stage you need to take the insulin injection to help your condition. And I would like to stress the importance of disposable to throw the needle in this container. I bring yellow container for you. So, after you finished the injection, you put the needle inside this container, and when it's full and you don't put any other needle inside it, go to the local pharmacy and then change this yellow container. They will give you a new one and they can take the old one from you.
Okay.
So are you not injured yourself or any of your family?
I see. And what happens? Because I am still a bit nervous about the injections. What happens if I freak out and, I can't inject myself?
I can understand it's very stressful because it's your first time, but I would like to assure you that you will get to use of it and then you will know how to do it. By time it will become natural and you can do it easily. So just to try now, and I will try with you for the first time and then so you can know how to do it by yourself. But I would like to assure you that it's straightforward and easy. You will get use of it and you will know how to do it again. And at the end I would like to summarize what we have discussed today. So, the doctor needs you to start insulin injection so to control your blood sugar level. So, and you will find a spot in your tummy, put the injection inside your tummy and then put the needle inside this yellow container, and when it's full, take it to the local pharmacy and change it for a new one. Do you have any questions for me today?
No.
Is it clear for you?
Yes. And thank you. That's the end of the first roleplay. Let's move on to the second roleplay. Again, you have 3 minutes to prepare. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the roleplay card if you want. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the second roleplay, and the roleplay number is number 2 for the profession of nursing. Please start preparing now. Thank you. The roleplay will now last about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please?
Hi, my name is Mary. I am one of the nurses here today. How are you?
Look, I'm really a little bit angry, to be honest. Yeah, I've been waiting for an hour to see a doctor, and no one's come to talk to me yet, and yeah, I'm really frustrated.
Yeah, I can understand your concern. It's really stressful when you wait for a long time, but as you can see, and I would like to explain to you that all the doctors are busy at the moment. They are looking for other patients who have really serious and urgent condition at the moment. So, when the doctor they are free, they will come and look after your child.
Okay, but I think that the reason that I'm so agitated and so angry is that my child is quite sick as well. So, I'm really worried that my child has asthma, and I know that that's a really serious condition. So, yeah, I really need to see a doctor.
Yeah. So, can you tell me please? You mentioned that your child is really sick. Can you tell me what's happened to him? What is his symptoms?
Sure. So, my child is 3 years old, and he's being wheezing, his head chest tightness, and he's had difficulty breathing. So, I looked up on the internet, those are all signs of asthma, so I'm really worried.
Okay. I can understand very stressful when you have a sick child, but can you let me do his vital signs to check his condition?
Is it possible that I could get a doctor to come and do that now?
I know you need the doctor, but as I explained to you, all the doctors here are busy at the moment, and when they are free they will. One of the doctors will come and look after your child, and I would like to explain to you when the doctor comes they will do some tests, so it will take time for them to figure out what's happened with your child, what the problem is. So, I would like to reassure you that I think your child condition is stable at the time. So, if you let me think the vital signs until the doctor come to make it faster and easier for the doctor when they come. So, What do you think?
Well, I guess it's, I don't really have a choice. But, when you take the vital signs, I really want you to tell me if my child has asthma or not.
Okay, I know it's hard for you to relax, but try to relax and let me take the vital signs, and I will tell you what I found in the vital signs. And yeah, that's all I can do at the moment until the doctor come and figure out what the problem is.
Well, okay, I guess you can take the observations, but yeah, I'm really frustrated that I can't know that if my child has asthma or not. I really wish you could tell me.
On my experience, I think his condition is stable, so I don't think it's asthma. But we will take the vital signs, and we wait for the doctor when they are free. One of them they will come and take a look after your child. But for now, can you let me take the vital signs?
Okay, go ahead.
Thank you.
Thank you. Thank you. That is the end of the second roleplay. Can I please have your roleplay page? We will now check the recording. We have confirmed that the test is being recorded successfully. Thank you very much.